This meeting is being recorded.
Hello everyone, this is Dr. Siddharth Dambar. Welcome to our webinar today. Today we are talking about regenerative medicine treatments for pickleball injuries. So what you should get from today's talk is as follows. We're going to talk about the 5 most common pickleball injuries, preventative measures you can take to prevent those injuries, how to treat pickleball injuries non-surgically, and regenerative medicine treatment options for these injuries as well. So after we're done today, you can always reconnect with us on any of our social sites. You can also go to chicagoarthritis.com, and we are available to answer your questions, or if you need more individualized help, we're here to help out with that as well. So before we begin, just a little bit about who I am. My name is Siddharth Dambar, physician here at Chicago Arthritis and Regenerative Medicine, specialist in rheumatology and in regenerative medicine, specialist in image-guided musculoskeletal injections. In practice since 2008, involved in regenerative medicine since 2008, part of the Regenix network, which is the largest network of affiliated physicians involved in regenerative medicine since 2012 as well. Just a little bit about my own personal journey into regenerative medicine starts with my own shoulder. I played a significant amount of tennis when I was younger, a lot of racket sports, and never really had any shoulder issues. But as I started going through my medical training, I learned about musculoskeletal ultrasound. And as I scanned my own shoulder, I started to realize that I had some mild chronic rotator cuff issues. As I re-picked up racket sports in my mid-30s, I then started to develop some shoulder issues. So that got me thinking about tendon and ligament injuries a little bit more differently, and realizing that a lot of our treatment options for these kind of injuries are fairly inadequate. And what can we do to do better? Which is what then eventually got me involved in regenerative medicine. So pickleball is obviously humongous in America and exploding throughout America. And which is a great thing because it is a relatively low impact sport, one that a lot of different people can play, a lot of different age groups as well as athletic levels, and it's incredibly social as well. The thing is, as there's been a pretty significant uptick in people that are playing pickleball, there's also been a fairly significant increase in the number of musculoskeletal injuries that we're seeing with pickleball players as well. In fact, I think in the last 2 weeks, I have literally seen a friend who got an Achilles tendon tear. My wife was in an ankle sprain. I saw a patient with a meniscus injury, another patient with a medial collateral ligament injury, another patient with an elbow tendonitis, another patient with a rotator cuff tear. So the sheer number of injuries that are happening with pickleball are pretty significant. They're not necessarily high impact, high traumatic injuries, but they are injuries nonetheless. So really the most common pickleball injuries, and of course it can be a lot of different types of injuries, but the most common ones that I see are ankle sprains, knee injuries, sprains and meniscus tears, lower back strains, elbow tendonitis, and rotator cuff tendonitis. And we're going to go through a little bit of these, how they're occurring, what's involved in them, and then we'll start talking a little bit about what can we do for treatment, and as well as what can we do preventatively. Traditional care for these kind of injuries is really inadequate. It includes things like pain medications, like anti-inflammatory medications and narcotic medications. Traditional injections like steroid injections or nerve blocks, which work short term, are not fixing the problem, don't work at the root of the problem, and they have potential long-term side effects as well. All these traditional care options are just about masking the pain with an intent that eventually things will get bad enough and then you'll need surgery. And that's a problem because that's not really treating the root of things. And all those kind of options have, surgery has its own surgical risks as well. So in searching for better options, we need options that are low risk, avoid serious side effects. They should address the source of your problem, which in the vast majority of cases are instability from prior injuries, and chronic inflammation and metabolic issues. So we want to improve the actual cause of the problem, and we want to give longer term improvement as well. Again, this particular video is being recorded, and so after we're done, you'll get if you're watching this live or if you signed up for this, you'll get an email for a recording link. And after we're done today, if you want to watch it again, you can catch it on most of our social sites as well as on chicagoarthritis.com. And by the way, as we're talking, you can always leave any questions into the chat or question section, and we'll make sure to answer those as we go along. So regenerative medicine. Regenerative medicine is the process where we're essentially utilizing your body's own cells to treat arthritis, tendonitis, injuries, and back pain. This utilizes a normal healing process. So if you think about how the normal healing process works, let's say take something small, like a cut on your finger. What happens is you first have platelets that infiltrate the area. They first stop the bleeding. They then release growth factors. Those growth factors then stimulate your local stem cells, which then brings in other cells, creates an initial inflammatory process, which is those other cells and growth factors coming in, which then slowly over time starts to repair damaged tissue, rebuild damaged tissue, and eventually remodeling that tissue. That can take a few weeks. For things that are more significant, a few months. So that is a good, healthy way for how tissue should heal. But for tissue that has poor blood flow, that can include things like cartilage, tendons, ligaments, other types of musculoskeletal tissue, including your discs, your labrum, and menisci. They're very hardy tissue, but once they get injured or recurrently injured, they tend not to heal very well on their own or adequately on their own. So regenerative medicine is the process of injecting your own cells, platelets and bone marrow stem cells, to coordinate that normal healing process into tissue that is typically not healing very well on its own. So why regenerative medicine? To begin with, it treats the source of the problem, which again is instability or inflammation. It's certainly safer than surgery. These are needle-based procedures. It's effective for the vast majority of musculoskeletal conditions. And for those of us that are involved in this field, strongly feel like over time, 80% of what's typically going to traditional orthopedic surgery will shift over to regenerative medicine, in the same way that the overwhelming majority of what used to be handled for heart disease, used to be open heart surgery, is now handled non-surgically, either through needle-based procedures or medications or something else, lifestyle changes without having to go for open heart surgery. So again, how does regenerative medicine work? You're optimizing your damaged tissue. You're improving strength and stability of the surrounding tissues, which I'll talk about in a little bit. You can reduce chronic inflammation in a joint or tendon, and we can also treat some of the other surrounding neuromuscular tissues to help with that as well. So let's talk about a really common issue in pickleball that you'll see, which would be ankle sprains. Most common ankle sprain is overpronation, as you can see in the picture here. The most common ligaments that are injured when that happens include the anterior talofibular ligament, which is in the front and outer part of the ankle, and then the calcaneofibular ligament, which is on the fully outer part of the ankle as well. When we talk about what is a strain, what we're talking about is there's an overstretching of the ligament. If that gets more significant, you can then get tears of the ligaments. That can be a partial tear or full tear. If a ligament has been injured, tends not to go back to normal. What that means is even after the initial injury, where there's inflammation and that swelling comes down, there can still be chronic instability because that ligament has been overly stretched. That secondarily will then lead to more, not only pain in that area and more frequent ankle sprains, but you can then also get stress on other parts of the ankle. That can include on the Achilles tendon and the plantar fascia. So ankle sprains happen a lot in pickleball because there's quick lateral movement. That's number one. And number two, I find that a lot of people do not have the right kind of court sneakers, court shoes. They're wearing either cross trainers or running sneakers that are good for that type of sport, but they're not right for pickleball itself, where you're having to make quick little lateral movements, which are putting your ankle at a lot more stress, which is why we see so many of these ankle sprains. So in general, how do we make a diagnosis for what's going on with you? This is not only for ankles, but this is in general. Well, number one, we're going to look at what's your history of injury and understanding how you injured it. What was your motion? What was your movement? Understanding classic injury patterns can lead to certain types of problems is really the first start. Then on examination, we're looking for where is there swelling? Is there any areas of tenderness? For example, let's say you sprained the ankle. Let's say you sprained the calcaneofibular ligament. Well, you're going to probably have some swelling in the lateral or outer part of the ankle. You'll probably have some tenderness underneath the bone there, underneath the lateral malleolus. And what's your exam findings, right? Do you have any maneuvers that trigger pain? Are there any examination findings that indicate instability, looseness of the ligament as well? That's how we help to make a diagnosis. Now, we'll utilize imaging, not really to just make a diagnosis, but to help confirm a diagnosis. For some areas of medicine, you need imaging strictly to make a diagnosis. In your musculoskeletal health, orthopedics and things of that nature, you're really starting with, okay, what is the history and what's the examination findings here? That gives you 90 to 95% of what you think is happening. And then you're using imaging, whether it's x-rays, ultrasound, or MRI, to then tailor in on, okay, this confirms your diagnosis and what's your severity of diagnosis as well. For something like an ankle sprain, I like ultrasound a lot because number one, you can do that right at the bedside, confirm that with your examination findings as well. And you can give a diagnosis very quickly, and you can dynamically look at how the joint is moving and how the ligaments and tendons are moving so that you can get a more dynamic diagnosis right off the bat. Next are knee injuries. There's so many different types of knee injuries, and they can all happen when you're playing pickleball. But let's talk about two specific ones, mainly because I've seen a lot of these with pickleball. These are the medial collateral ligament and the medial meniscus tear. So when you go to the inner part of the knee, meaning the part of the knee that is closer to the other knee, you have a number of structures that are helping to support the joint there. One of them is the medial collateral ligament that connects the two sides of the bone there over the joint. And right underneath that, you have the medial meniscus. The medial meniscus is a thick portion of tissue that basically sits between the two bones there. It's a thick portion of cartilage and helps for the joint to remain stable as well as to move in a smooth and free motion when you're flexing and extending. So what typically happens is if you're planting your foot and quickly twisting your knee, those two structures can get injured. And that sort of injury can be a strain where you have, let's say, fraying of the ligament or just a little bit of micro tear of the meniscus, or that tear can be more significant, right? Where the medial collateral ligament can be more significantly torn or the medial meniscus can get more significantly torn. What happens when those structures get injured is that, again, they don't typically return back to 100%. It can lead to some micro instability there. That instability over time can then make you more prone to osteoarthritis as well. So very common type of injury pattern that we see, because in a sport like pickleball, where you're having to plant and quickly turn one way or the other way, you are then potentially straining or risking your knee. One thing to think about to help combat that is as your opponent is about to hit the ball or as you're hitting the ball, if you do a quick split step, a quick bounce on your toes, you've now gotten out of that planted or fixed position. You're now in a little bit more of a position where you can move a little bit more dynamically, so that now when you're moving, you're not suddenly straining a ligament or meniscus that can get more easily injured. So quick little split step will, number one, give you a faster reaction time and can actually help to reduce your chance of injuries for that sort of injury that happened when you're planting your foot. So let's talk a little bit more about imaging. What kind of imaging are we doing when we're talking about pickleball injuries? X-rays are frequently done. Really, when you're doing X-rays, what you're looking for do you have osteoarthritis, wear and tear arthritis, or do you have a fracture? You don't typically see fractures in pickleball injuries. It can happen, right, if you've had a bad injury. But it'll frequently be done as a first line option because you just want to get like a big picture view of what's going on. Musculoskeletal ultrasound, as I mentioned, is my preferred imaging modality when someone is coming in with an acute sports injury, because we can look at tendons, ligaments, and joints. We can look at them in a static motion. We can also, or static position, but we can also look at them with dynamic scanning. And what that means is we would have, let's say, your ankle, right, or your knee. We can now flex and extend, move the ankle around, move the knee around, and we can see how does the ligament look, how stable is the joint. It would be an indication if a ligament had been torn or injured. How do the tendons look as well? It gives you a better look at those tissues to tell, is there any signs of impingement, or is there any signs of hidden injuries, any signs of instability? MRI is a very detailed study. It can be very helpful in some cases as well. It's helpful if you're looking for bone edema, swelling in the bone, which can happen chronically in some people with wear and tear arthritis. It can also give you a more detailed and appropriate look at the labrum and menisci that cannot otherwise be well seen in any other imaging modality. So depending on what you're looking for, the MRI can be very helpful. People will frequently use MRIs to look for ligament and tendon injuries. For something like an ACL tear in the knee, MRI is the diagnostic test of choice. But for other types of ligament and tendon injuries that are well visualized on ultrasound, you can make a very good argument that ultrasound is a better option because, number one, you can do that right at the bedside when the patient is right there and you know what the injury pattern was, and you can do that and have a very quick look at that. But also, because of the dynamic nature of ultrasound, that you can move the ligament and tendon through a full range of motion, you get actually a more full view than you would with MRI, which is typically more of a static image. So lots of great imaging choices if needed. This slide shows a few different pictures of what this imaging can look like. And in this case, on the far left, you have a knee MRI image showing an ACL tear, where the ACL, which is normally nice and linear, has a tear to it. On the top, you have a rotator cuff tear on ultrasound. Again, this black hole right in the middle here is where you have your ACL or your rotator cuff tear. On the right, far right, you have an ankle that shows a little bit of fluid, some narrowing of the joint space, and also shows some swelling in the bone. That's called bone marrow edema. If you let that sit there, that will eventually cause more damage to the bone as well as to the cartilage as well. And that is something that is treatable. And lastly, on the bottom, it's an ultrasound image of a patellar tendonitis. You've got the bone, which is that hyper white line. You've got the tendon that extends there. And then you've got some tendonitis changes, which is that bone spurring or calcifications in the tendon as well. So imaging can be very helpful, but it's most helpful when it fits with what you're looking for based on your exam and history. The next common injury that I see in pickleball players are back strains. And the reason why is because with pickleball, there's a lot of dinks and a lot of short kind of shots, and you very quickly have to reach forward and run forward. In addition, that sort of lateral movement, sometimes you're not even moving your legs that much, you're just quickly moving to one side. And what you end up doing is you end up straining or stressing for sure, sometimes straining, and injuring the ligaments such as iliolumbar ligament and the sacroiliac ligaments. That's the most common ligaments that get strained in the lower back when you have back strain. So classically, you'll continue to have pain with movement, either lateral movement or leaning forward. The symptoms, even from a ligament injury, can feel like a nerve pain, meaning you'll have pain that not only is in the lower back, but it'll go down to the hips and sometimes down the legs as well. Now, the thing is that if you've had strain of those ligaments, you are then more prone to injuries to the facet joints, stress on the nerves as well. So long-term, after a strain to those ligaments, you can then develop a lot of other back issues as well. But generally starts with, first and foremost, an injury to those ligaments, iliolumbar and sacroiliac ligaments. Now, the interesting thing is that, again, there are ways that when you're playing, you can help to prevent that. To begin with, I mean, you hear people say this. I heard this when I was a tennis player all the time. Coaches would say, bend at your knees, not at your waist, right? And so if you're strictly bending at the waist, you're now straining the hips in the back, rather than taking some of the load on the knees. So if you can bend more at the knees for some of those short and low balls, you'll be able to take some of the stress off your back. Also, that split step where you're now on your toes, you're no longer being caught unaware. You're now sort of ready to move before when your opponent's hitting the ball. So by the time the ball gets to you, you're already in motion. You're not reacting late. You're generally not having to sort of strain and quickly lean forward. Sometimes you still have to do that. But if you can be in the right position to begin with, you can sometimes save your body as well. So stability is a big part of a lot about this. You'll hear me talk about this a lot. So biotensegrity, well, let's talk about tensegrity. Tensegrity is this concept in architecture, which means that if you take individual units that are weak on their own, if you put them in closer proximity, compress them together, you now have a total structure that is much stronger than the individual units. So in biology or in medicine, that's called biotensegrity. So as an example, when you look at somebody's knee, when somebody has pain, it's not just that you have arthritis in the knee or that you have one single structure that's been injured, it's an entire structure there. What gives you support in, let's say, the knee joint is you have the knee joint, you have the meniscus, you then have the ligaments that are sitting right on top of the bone, connecting the bones together. Over that, you've got tendons. An extension of the tendons are the muscles. In between all those tissues are myofascial tissue, connective tissue that helps to support and compress things as well. And lastly, on top of all that, you then have the skin that helps to hold things together as well. So you have a very compact unit of individual structures that are weak on their own, but when you put them together, you now have a structure that is tight and strong and still very dynamic in its motion ability. So that's how biotensegrity works in the body. When something gets injured, the way that we try to treat that is by strengthening those individual structures. Prolotherapy is this concept in regenerative medicine where you can inject your own cells into those soft tissue structures to help strengthen them. The keys are that you want to treat all those structures that are involved. So if somebody has, let's say, a meniscus tear, medial meniscus tear, you don't only want to inject into the meniscus or the joint, you then also want to inject into the medial collateral ligament that's supporting that, likely also into any supportive tendons or myofascial tissue that are there as well. The keys are you want to be comprehensive in treatment, and you need to understand that these results are longer lasting, but there is progressive strengthening that happens over time when you try to improve things via prolotherapy route. So instead of having results in the first 2 or 3 days, you now have results that will take weeks to months, which then gives a more durable response that can last from months to years. So this concept of prolotherapy is all about strengthening the ligaments and soft tissue structures around a joint functional unit to optimize that. From a treatment standpoint, when we talk about prolotherapy, there's 2 different things that we can be talking about. We can be talking about using a basic type of prolotherapy, which is using dextrose or sugar water. That's the original regenerative medicine treatment that's been around for many decades. I think you go back to the 50s or maybe even the early 40s where people were utilizing that. Then there's an advanced version of that where we're using your own cells, like your own blood platelets and your own bone marrow stem cells. So to give a sense for how these treatments relate to each other, dextrose prolotherapy is a mild treatment. Generally, we'll recommend monthly treatments for 3 to 6 months, generally starting with 3 to see how you are and then decide if we have to do more. PRP or platelet-rich plasma is a stronger version of that from your own blood. I'll talk about that in a moment. And that we're generally repeating treatment anywhere from every 3 to 12 months as needed. And then there's utilizing your own bone marrow stem cells, where if you need to be repeating treatment, now you're doing that once, roughly every 5 years or so. But to get a sense for how these treatments work, what takes 3 to 6 prolotherapy treatments can be achieved with maybe 1 up to 2 PRP treatments. And that's equivalent to 1 bone marrow stem cell treatment. So from a strengthening standpoint, these are all very helpful, but from like a degree of power kind of treatment starts low as dextrose prolotherapy, then PRP, then bone marrow stem cells as your strongest treatment. Okay, next, elbow tendonitis. Common one that you see in really all racket sports, certainly in pickleball as well. This can be pain on either side of the elbow. That can be medial epicondylitis, that's on the inner part of the elbow, or lateral epicondylitis on the other part of the elbow. So when we talk about lateral epicondylitis, that's on the outer part of the elbow, that's called pickleball or tennis elbow. And you typically see that in folks because when they're playing racket sports, because they're doing one-handed slice shots or one-handed backhands, right? It can be topspin or flat as well. So generally one-handed backhands, you're putting a lot more stress on that outer part of the elbow. There are ways to strengthen those tendons called eccentric exercises, which physical therapy can teach you. Using a tennis elbow band can help take some of the pressure off the elbow, but you still need to do the strengthening exercises. And frankly, even just using a two-handed backhand shot can help take the pressure off that as well. Pain on the other side of the elbow can happen just from forehands. That's called medial epicondylitis, and again, can be very treatable as well. So when we talk about stronger regenerative medicine treatments, we're talking orthobiologics. What these are the biologic cells and tissues that we inject into damaged orthopedic tissue. I talked about that normal healing process where platelets come in, stimulate your stem cells, start that normal healing process. Important to use your own cells. You may hear about people using somebody else's cells. In the United States, that is not legal. Using your own cells is the only thing that is, own living cells is what's legal. You may be able to go to other countries, but understand that there's very limited evidence of how well that works in comparison to using your own cells, where the data for the last 15 years is very robust. Platelets are really the first line orthobiologic treatment. As I mentioned, after an injury, they get activated, utilizing focal inflammation to help repair and optimize damaged tissue. And again, your platelet growth factors stimulate your local stem cells. That's how they work. There's different types of platelet preparation. There's platelet-rich plasma, which is a high concentration of your platelets. There's platelet lysate, where we're cracking those platelets and just taking the growth factors, tends to be less inflammatory. We'll use that for nerves. For all platelet preparations, you do a blood draw, concentrate that via centrifuge, and just isolate the cells that you want. The way that you would know if you're getting a legitimate treatment would be the following. You'll hear of places where they're doing platelet-rich plasma, where they're taking 1 or 2 tubes of blood. That's a very low concentration of platelets, not a good quality. If you're getting a treatment, you should be getting minimum 6 tubes, even up to 20 tubes, depending on what you're treating. That's how you get a higher concentration. So higher concentration of platelets are better for joints and tendons. We'll vary the dosage based on what we're treating, possibly a very high dose for your joint, medium dose for tendons, and then maybe even platelet lysate for nerves as well. So a lot of places do not have that flexibility, and that's a problem. You need to have that flexibility to get a good outcome. Next common issue that I hear about are rotator cuff issues, rotator cuff tendonitis. A bit less common than tennis. Tennis, you do more overhead activity because of the serve. And the ball is heavier, the racket is heavier, so it tends to strain the shoulder more. While in pickleball, when you're serving underhanded, so you don't tend to have quite as much rotator cuff things, but they can still happen just because you are using your arm so much. So there are 4 rotator cuff tendons. They provide power and control to your shoulder, very important. When you get an injury to that can be anywhere from a tendon strain, that means there's just a little bit of roughness or fraying to the tendon tears. Tears come in different varieties. You can have a partial tear. Let's say this is your tendon. Partial tear where there's just a little bit that's been injured. You can have a full thickness tear where now there's a full section that goes through the tendon. That can be closely approximated. That's still treatable without surgery, or it can be fully pulled apart. If it's fully pulled apart or retracted tear, that needs surgery to be put back together. Post-treatment, I would recommend putting your own bone marrow stem cells back into that tendon that's been repaired to help strengthen it long-term, because even after surgery, those tendons can be prone to re-tearing. And if you inject your own stem cells in, that can help to prevent that. The other thing to keep in mind, and by the way, a tendon that is torn but still closely approximated, we can still treat those. The other thing to keep in mind with rotator cuff tendonitis is it's not just the tendons, it can also be the ligaments. So there's a ligament underneath the shoulder called the inferior glenohumeral ligament. very commonly strained, especially in overhead activities, including racket sports. And so the key is that when you have a rotator cuff tear, to treat not only the tendon, but to also treat the ligaments that probably were originally weakened that led to that tear as well. Now, the thing with rotator cuff tendonitis is, especially with racket sports, is that with proper technique, you can reduce the stress on the tendon. With the right strengthening exercises, you can reduce the stress. One key thing when it comes to technique is that if you are primarily using your arm for overhead, either serves or overheads, understand that you are straining, that you're putting too much stress on the tendon and the shoulder, and you should not have that. Realistically, if your technique is right, you should really be utilizing your whole body. And that starts with your lower body as you're kind of getting a platform of power to start in there. And then as you start uncoiling, that then translates from the legs through your core, through your upper back, and then eventually to your shoulder, elbow, and wrist. When you're swinging overhead like that, you're now using your whole body. You're not just focusing on the shoulder, which will then actually help to prevent or spare your shoulder as well. So technique makes a big deal here. The next type of orthobiologics to be aware of are stem cells. These are the main cells that drive tissue repair and recovery after an injury. Use your own cells, not somebody else's. The evidence shows that using your own cells is adequate and appropriate, and it's much safer because when you use somebody else's cells, there's always a potential risk that your body can reject that. Also understand that bone marrow-derived stem cells are the only legal stem cell product that can be sold in the US that has living cells. Fat stem cells are not legally allowed in the US because you need to utilize an enzyme called collagenase that the FDA has concerns about in humans. You can use adipose or fat as a connective tissue barrier. So for example, let's say you have a tear in a tendon. You can use your own bone marrow stem cells for the stem cells and then utilize the adipose for some connective tissue to help keep them in place. You may hear about amniotic or umbilical cord cells or exosomes. Understand that there's no living cells in those products. In order for those products to be legally approved in the United States, they have to be processed in a manner that is very harsh. And so by the time they get to the doctor's office, there's some growth factors there, but there's little to no living cells remaining. IV stem cells, you may hear about this in other parts of the world. Understand that there may be some benefit for those in terms of overall inflammation in the body, but there's really limited to no evidence of whether that's beneficial in orthopedic conditions. So when it comes to stem cell treatments, yes, we are able to significantly improve your pain and function, even if you have advanced arthritis or problems, all right? Now, can we improve your X-ray or MRI images? If you have advanced arthritis, I cannot get your X-ray to look like what it was 30 years ago. If you have a tendon tear or ligament tear that's less than 2 centimeters, we can get that to not only repair or to improve functionally and pain-wise, but we can actually get that to look close to normal or back to normal on imaging as well. I'll show some cases of that. If you have swelling in an arthritic joint, we can get that to certainly improve. If you have swelling in a bone, avascular necrosis or bone marrow edema, at an early stage, we can still get that to reverse as well. Can we treat bone-on-bone arthritis? I hear this all the time. Simple answer is yes, arthritis is a biologic condition. It's treatable with biologic treatments, orthobiologic treatments. In particular, if your range of motion and function is still intact, good outcomes are still very possible. Some caveats, understand that if you've got advanced arthritis, your expectation should be about improving pain and function. Improving your imaging is unlikely. The other caveat is that if you have advanced hip arthritis, that seems to be much more challenging in terms of good outcomes. And so we'll frequently, for advanced hip osteoarthritis, refer folks for surgery for that. Let's talk a little about prevention. That's always preferable. When it comes to prevention, here's what you should be thinking about. Number one is stability. All right. So like I mentioned before, court sneakers, I find that, or court sneakers, wearing appropriate sneakers for racket sports, whether that's pickleball or tennis. Those kind of sneakers tend to offer more ankle and foot support that are appropriate for lateral motion. Running sneakers, cross-training sneakers are not really correct in that regard. Also think about doing the right preventive exercises. So if you know that you already have a chronic ankle issue, a chronic shoulder issue, physical therapy can teach you the right kind of exercises to do so that you are protecting those, strengthening those long term. And if you're going to be doing dynamic activity like pickleball, where you're stressing those kind of areas, then doing those kind of preventative exercises will be very key. The other thing is, I've heard of some people where like their only activity that they're doing is pickleball, and that's not the right way to really exercise or stay healthy. You need to be doing some general strengthening exercises as well. So even if you don't have a knee issue yet, you should be working on strengthening your hips. The reason why is because there's this kinetic chain from hips to knees to ankles and feet when you're running that if one area is a little bit weak, can cause more problems downstream. So if your hips are a little bit weak, which is very common in our modern society based on how we live, your knees can be more at risk for getting injured. So a general strengthening program is key for everyone, but certainly if you're doing dynamic exercises like pickleball. The next, as I've mentioned, is technique. I think technique is so key for preventing injuries. Things as simple as, are you doing a split step as your opponent is hitting the ball? Are you utilizing your whole body appropriately, not just sort of arming it or just swinging through with your arm, which is going to strain the arm? Good technique, good positioning can go a long way to preventing injuries. Metabolic health, for folks who are more prone to inflammation, that can be because you have a metabolic problem like diabetes, high cholesterol, you may have an autoimmune issue. Those folks are more prone to inflammation, right? More inflammation means your joint or tendon can get more injured. Strongly make sure you're maximizing your metabolic health. That can include food and supplements as well, right? In general, a balanced diet that's not heavily one way or the other, and that is not that is reduced in terms of refined processed foods is better for your metabolic health. Supplements, things like glucosamine, omega-3, turmeric, are healthy for joints as well as healthy for reducing your inflammation. And lastly, in that regard, is also aerobic exercise. Part of your general exercise regimen every single week should be some aerobic exercise to maximize your metabolic health. If you can maximize your metabolic health, you reduce your inflammation. If you get an injury, it's not going to be as bad. Body weight optimization is part of this as well, right? Realistically, if you can optimize your body weight, you're putting less stress on your lower extremities, including hips, knees, back, and ankles and feet. If you can do that, you're less likely to get injuries as well. So initial approach to treatment of injury should be the things that you should definitely do. To begin with our rest and activity modification. You've injured something, make sure that calms down. Physical therapy to help recover from that injury and to help prevent future injuries. Anti-inflammatory supplements to help reduce inflammation as well. Things you should be cautious about, and these are things that are commonly done. Ice. I get it. Ice helps to reduce pain. The reality is that it's reducing blood flow as well. Might be okay short term, but you want blood flow to help recover from an injury. NSAIDs, anti-inflammatory medications, ibuprofen, Advil, Aleve, Celebrex, diclofenac. They help with pain, right? Short term, okay, maybe a little bit, but if you do too much of it, that they also block platelets. That's one other side effect that they have. Knowing how key platelets are to recovery after an injury, you have to be cautious with that. And the other one are steroid injections. I would be very cautious about getting a steroid injection after an injury, and the reason why is because while it's reducing inflammation, it's also suppressing or damaging the cells that are critical in your normal recovery process. There are certainly other types of injections that can be done that are healthy, whether you're talking prolotherapy or PRP, platelet lysate, that are going to be okay in the setting of an injury and that are healthy for the joint as well. Next level treatments, if you fail conservative options, physical therapy and rest, consider regenerative medicine treatment options, if appropriate in your case. Again, that's dextrose prolotherapy, platelet-rich plasma, bone marrow concentrate stem cells. Choosing the treatment based on your severity of your problem. What other medical issues do you have? For example, let's say you've had knee surgery in the past. Good chance you'll do better with bone marrow rather than with just platelets, just because you've already had trauma to the knee before. Like I said, what prior surgeries have you had? And then what are your goals from treatment? Are your goals primarily pain relief? Are they more functional, like you're trying to get back to specific activity? If it's more, you're trying to get back to a specific activity, sometimes using a stronger treatment may be a better option as well. A few case studies I'll kind of go through fast here. Again, any questions, please let me know. It's a case study of an individual with lower back pain, 71-year-old man, chronic lower back pain, prior surgery as well, still having back pain. This is someone who ended up first starting with platelet-rich plasma with us. We ended up treating his ligaments, facet joints, muscles, and epidural space. Again, that concept of biotensegrity and prolotherapy, treat all the structures that are involved in the functional unit. The PRP, he had 30% pain relief. We ended up escalating to using his bone marrow stem cells, up to 75% pain relief and still doing well. Good example of where escalating treatment can be useful. Good example of where treating the whole functional unit is important. And good example of where sometimes, if you've had surgery already, you may need a stronger treatment option. Interventional orthopedics. This is the idea of using image guidance to treat orthopedic injuries. So this is a picture of a rotator cuff. There's a very small hole. You'll see the white line there. That's a needle injecting into that very small tear of the rotator cuff. That's so small you cannot do that blindly. You have to use ultrasound guidance. This is a X-ray image of a shoulder as well, injecting into the joint. That is the joint. You see a little bit of contrast in the joint. That's the needle. What's interesting is you also see a little triangular structure there. That's the labrum. To hit the labrum blindly, very hard, possibly impossible for most people, but can be done under X-ray guidance. So again, showing where image guidance is key. It's a case study of a patellar tendonitis case where it's an individual who had failed physical therapy, activity modification. He's a cyclist. This picture here is, again, this white line here is the patella, the kneecap. This is the patellar tendon. These little bony spurring, that's patellar tendonitis. We ended up using ultrasound guidance and platelets, 2 treatments in his case, injecting directly into the patellar tendon. He's done great with his patellar tendon on that side. I saw him a few years later. His other leg now had a hamstring injury. Again, using platelets again in his case, and he's done great. Great example about platelets are a good first-line option for a lot of soft tissue or tendon injuries, and how repeat treatment can be helpful, and how getting back to a high level of physical activity is very possible. So interesting question, can tendon and ligament tears be treated? Partial thickness tears for sure, sometimes even full thickness tears. So this is a 28-year-old butcher, is playing recreational volleyball, tore his ACL. I treated him within 3 months of his injury. He had a great result. We use his own bone marrow stem cells. This is an image, X-ray image. This is the needle. This is the knee. And what you see in the middle, what is lighting up, that is the ACL. So we can inject the ACL. To do it properly, you have to do it under X-ray guidance. So in his case, this is his MRI pre-treatment, all right? This is his on the left. That's his ACL, very hazy, at least partially torn, possibly fully torn. That's what the radiologist read it as. 3 months later, after treatment, this is an ACL. This looks like a normal ACL. It's strong, it's functional, and it looks great. Still a bit of swelling, still healing, but looks absolutely fantastic. This is a 57-year-old contractor, used bone marrow stem cells for his rotator cuff injury. This is an ultrasound pre-treatment. That is a full thickness tear. 2 views of that. That's that hole in the tendon. This is 3 months after, under ultrasound guidance, and again, totally filled in now. So I treated this 7, 8 years ago. He had a mild strain recently, the same shoulder, tendon still intact. We ended up using platelets to kind of give him a booster treatment, and he's back on course, doing great. So image guidance, absolutely essential. To do this blindly is not appropriate. Image guidance, you have to use image guidance for regenerative medicine treatments. This is a case of an ankle AVN case where AVN, avascular necrosis, is swelling and damage to the bone. If you leave it untouched, it will lead to damage in the cartilage and eventually progressive arthritis. We utilize his own bone marrow stem cells. This picture on the left is pre-treatment. It's a little bit of fluid in the joint. There's some joint space there consistent with wear and tear arthritis, and the bone itself is starting to get damaged. So in his case, we inject it into the joint, the ligaments, and we inject it into the bone. This is his imaging a few months out, that swelling in the bone has resolved, swelling in the joint has resolved. His MRI looks amazing. And functionally and pain-wise, he's doing great. One last aspect of this, you're probably wondering, so who should you go see for these kind of treatments? Here's what I recommend when it comes to choosing your regenerative medicine expert. First and foremost, they need to be a musculoskeletal expert. Your physician needs to be focused on these kind of treatments. And that means they should not be running in one room treating somebody's blood pressure, in another room treating somebody's erectile dysfunction, then finally coming to treat your knee. They should be focused just on your musculoskeletal health. Number two, they should be non-surgical experts. This is key because our orthopedic surgeons are trained expertly and appropriately in surgery. They don't get the full spectrum of expertise when it comes to treating this non-surgically. And what that means is they're not getting the right kind of ultrasound or x-ray guidance training to do these procedures properly. If you do these procedures without imaging, it's a bit of a crapshoot whether you're going to get any benefit because you may not be in the right structure. You need image guidance for all these procedures. And then your physician should understand how inflammation works. So I see a lot of physicians who inject a ton of steroids, and it's such a problem because it's damaging the cells and tissues eventually, but also not understanding that some degree of inflammation is useful, helping to heal from an injury. Chronic inflammation is not, excessive inflammation is not, but we have an epidemic of steroid injections by physicians in this country when they should be using these treatments instead. Next, your physician should understand that your biologic treatment should be tailored to your specific problems. If your physician is giving the same treatment to every person who comes in, a hammer that's hitting every single nail, that's not the right way to do this. You should get a bespoke treatment. They should be tailoring your platelet preparation based on what you have, your mix of treatments based on what you have, because that's how you get a better results. And then they should understand the concept of instability in prolotherapy. You'll see something amongst a lot of pain management doctors that do a lot of injections. They have the right image guidance skills, but they do a lot of nerve radiofrequency ablation. That means you actually burn a nerve. That can give pain relief in some cases, but a lot of times those same nerves supply control and power to the muscles as well. And that can leave the overall area weakened, which is a real problem because that causes more instability. But even if that nerve is only supplying sensation, to some extent, proprioception, which means control of your joint in space, you lose some of that as you start to injure or burn off the nerves. And so understanding prolotherapy and instability is key. The other thing is they need to be very transparent regarding your results and candidacy for treatment. When I had first started these treatments back in 2008, even 10 years ago, you would have other physicians that would tell their patients they didn't think these treatments worked. And they were not aware of what the data was, that yes, it does work in some cases. Now, 10 years later, you'll see some of those same physicians. They may be offering some of these treatments, but they'll tell their patients, they're still not sure how well these treatments work, but let's give it a try. So these treatments have been around since the mid to late 90s when it comes to prolotherapy and platelets. I'm sorry, bone marrow and platelets. Prolotherapy goes back to the 50s or even earlier than that. So, and the sheer number of level 1 evidence that's been published in the last 10 to 15 years is astronomical for PRP and also for bone marrow. So when your physicians say they're not really sure of how well this is going to work, they're not an expert in this. Your physician should be able to tell you what's an expected result, what's your candidacy for treatment as well. Are you a good, fair, or poor candidate? And then your physician should follow your results long-term. Understand that these treatments they're newish. They're not new. They've been around for decades now. But they need to follow you long-term. If your physician is just strictly doing the procedure and you're never seeing them again, that's not right. They need to follow you long-term, and they need to be able to guide you through the process, answering your questions, and helping you to get healed as best as you can. Regenerative medicine treatments offer safe and effective solutions for your pain. look, pickleball is exploding in America, and in part it's because it's fun and it's a sport that a lot of people can play. It's incredibly social as well, which is, I think, a big part of why people enjoy playing pickleball. And, you know, with appropriate preventative things that you can do on your own and with appropriate medical treatment, if you get injured, staying active, continuing to play, staying on the court is very doable and a worthwhile activity to continue to pursue. If interested in getting evaluated after we've talked about all this, check out our website, chicagoarthritis.com. You can check out any of our social media sites. You can contact us via that. There's our email address. There's our phone number. We are available to help you out and help keep you on the court and active. Great. Well, I don't think there's any other questions at this time. If we can be of further help, please let us know. And until we connect again, I hope everyone has a good day and lives well. Bye-bye.